Every year in the US, 40,000 children are born with congenital heart disease. These are children that have a diagnosis that represents a long and difficult journey. I can't imagine what those families go through. To have to worry when your child's running, if they're tired, to have to be concerned if they have a fever. Right now, there's a lot of physicians that are fighting to help these children, but unfortunately, these physicians are ill-equipped. 70% of the tools they use to help these children are off-label. They're tools not designed for them, but they use them to help these patients. We want to come alongside people that are on that journey and say, we've made something for you, not just what you need in this moment, but we're thinking about your life. We're thinking about how you will grow and what you will become, and we want to be a solution that adapts with you.
If you think about pediatric cardiology versus any other kind of cardiology, the big glaring difference is our patients grow. So we have not had technology that addresses that.
Our mission is to make purposeful devices for patients that are born with congenital heart disease. Our first opportunity is a growth stent. Our stent, the Minima stent, is crimped on a 4-French catheter, which has the ability to be placed in the blood vessels both on the arterial side and the venous side of our smallest children. And not only can it be crimped down that small, it is designed to be redilated all the way through to adult size, covering a range that's unprecedented for any stent technology. We wanted to keep this as simple as possible for pediatric cardiologists. The Minima stent is the first stent to be designed, tested, trialed, and now FDA approved for use in infants.
And it was basically everything we were waiting for. It was far simpler than the current stents we have. The cases were smooth, it was predictable, and maybe most importantly, I got to tell those families, when the time comes and your babies are not babies, they're running around the playground in 3rd grade, we can make this bigger. You're not going to need more surgery to deal with this. And for somebody who provides care to families, that was a really great thing for me. I think to be able to offer a minimally invasive solution where you go home the same day and don't have to go through all of that morbidity will be profoundly important for families.
We are forming collaborations with regulatory bodies, with physicians, with parents, with hospitals. We envision a world where we bring people together and make an incredible impact for these little lives.
Having been doing this since the late 80s, to sit there in 2024 and be able to talk to a young couple, first child, just got this news, and I literally say this to this family. I say, I'm going to start with the end of the story, and the end of that story is your kid is going to do great, and your kid is going to grow up and lead a normal life and be a normal adult. And I didn't used to be able to say things like that to families.
We want to be the solution that comes in and says, we thought of your child, and we have what it takes to give that physician the tool that they need to change the trajectory of that life.